as a member of the Global Commission on Drug Policy, very proud to see how political mobilization and commitment can change drug policy to be more evidence-based and human rights-oriented. That is why I'm inspired to initiate a regional commission on drug policy, the one that will be focused on specific issues and needs of Eurasia region.
Eastern and Central Europe and Central Asia is one of the two parts of the world where the incidence of HIV infection continues to increase, or at least is not decreasing. 40 years after the beginning of the HIV epidemic, it is an issue. It is an issue for the region. It is an issue at global level. 30 to 50% of new HIV infections occur in the region in people who are injecting drugs. And drug policies are obviously a major determinant in how people relate to drugs and whether people will or will not become infected with HIV, hepatitis, and other consequences associated with unsafe drug injection. So I think it's more than time that in the region we open an evidence-based, open and free debate within our societies, within our countries, and at regional level to discuss whether our current policies are really answering the issues we face, and whether there is anything, and I'm sure there are lots of things we can improve, so to place the health of the people, the health of the community, the health of the region as a key priority.
National drug policies in Central and Eastern Europe, as well as in Central Asia, should undergo profound transition based on, first, decriminalization, and secondly, drug market regulation. Decriminalization is the prerequisite for human, people-centered, and cost-benefit drug policies. Millions of people in our region who use drugs, instead of criminalization, they rather need medical and social support. They are suffering from repressive drug policies, as well as police practices. These people are stigmatized, marginalized, and have no opportunities to speak up and act openly because drug use and drug possession is criminalized and severely punished. Instead of medical and social support, they get years of imprisonment. Secondly, regulation of drug markets. That means to put governments in control instead of criminals, organized crime groups, and mafia, for the public health as well as public safety. This is inevitable.
We believe that law enforcement efforts should be focused on criminal organizations, but not on drug users who can be regarded as victims. Millions are incarcerated just for possessing minimal amounts for personal use. It is not fair to punish somebody for being chronically ill. We will pursue high-level engagement with heads of state and government, parliamentarians, and multilateral organizations regarding efficient and fair drug policy in the region.
There are 3 million of people who use drugs in the region. Drug policy affects them directly and millions of their relatives and whole societies because of negative consequences over public health and safety. We commit to start our efforts to end prohibition and punitive approaches which prevails in the region. Together with our partners in the region, we will mobilize expertise, raise public opinion, and get political commitment to change drug policy. We will support the ongoing debate on drug policy reform, public health approaches, and criminal justice.
All policies must preserve social well-being, human lives, and dignity. Now we witness many negative consequences of current drug policy: HIV, tuberculosis, hepatitis, epidemics, human rights violations and corruption, economical losses, etc. With scientific data and strong arguments, in cooperation with civil society and communities in the region, we are ready to support progressive and pragmatic reforms.
Drug policy is a very complex field. It's at the intersect of health, of justice, law enforcement, human rights, politics at national, regional, and international level. It is a key issue for the region, and I must say I'm really thrilled to join the remarkable group of commissioners we have for our Eastern and Central European and Central Asian Commission now to open the debate at regional level on what it is that we have to change in the way we approach drug policies for the benefit of the people and of our societies.
The Eurasian Commission on Drug Policy is composed of the former head of states, high-level politicians, scientists, philanthropists, and opinion leaders from the region. I believe and I'm convinced that acting together, we will consolidate expertise, political commitments, and efforts to change drug policy in the region.
Все своє професійне життя я займався питаннями державної безпеки, в тому числі і з фокусом на питання безпеки у сфері наркотиків, все, що стосується нелегального та легального обігу. Весь мій професійний досвід переконав мене в тому, що в наркополітиці має бути дотриманий баланс. З одного боку, правоохоронні органи мають виконувати свою роботу так, щоб запобігти нелегальному витоку та обігу. Однак, з іншого боку, і це дуже важливо, контролюючі органи та заходи не мають обмежувати доступ до підконтрольних препаратів в медичних цілях для пацієнтів. Це ненормально, коли лікарі бояться призначити наркомісні препарати, і сотні тисяч пацієнтів страждають від болю. Разом з тим, діяльність правоохоронних органів має бути спрямована на організовані злочинні угрупування, а не на звичайних людей, які споживають наркотики та зберігають невеликі розміри для власного споживання. Переслідування хворих людей, затримання, вибиття показань, використовуючи абстиненцію, кваліфікується як тортури. Це не робить честі правоохоронцям, але довгі роки робило гарні показники псевдоефективності роботи. Впевнений, нам є куди змінювати наркополітику на краще, в сторону більш гуманного та ефективного підходу, використовуючи принципи прав людини, зменшення шкоди та відміни кримінального переслідування для людей, які вживають наркотики.